Bismillahirrahmanirrahim. I am Dr. Nizamuddin Uthmani, working as assistant professor, medical specialist and gastroenterologist at Khyber Teaching Hospital, Peshawar. I am teaching pharmacology and I am practicing medicine and gastroenterology. Today we are going to discuss one of the most important antibiotics, and that is the macrolides. What are the learning objectives for today? Describe the macrolides, describe their different types, and then describe their clinical uses, describe their adverse effect, and of course we will explain how the resistance developed to macrolides. You know, macrolides is a very good antibiotic which is derived from one of the fungus and Saccharophyllospora erythraea. They are known for a particular ring, what we call as the macrocyclic lactone ring, and you know they have different number of atoms. Some have 14, some have 15, and some have 16, and then they are classified according to on the basis of these number of atoms. They are widely used for the bacterial infection, especially for the respiratory tract infection and for the soft tissue infection. You know their chemical structure, we have already explained that they have got a large lactone ring, what we call as the macrocyclic ring, and which is attached with the deoxy sugars. And then they are classified according to the number of atoms. So some have 14, some have 15, and some have 16. 14 members are most commonly used one, that is the Erythromycin and the Clarithromycin and the Roxithromycin. The 15 member is also one of the very important drugs, that is the Azithromycin. While the 16 member macrolide, it is not that much important, but nowadays it is used for some resistance cases, and that is the Spiromycin. But we still use these four macrolides, which are the most common one and which are the most important one: the Erythromycin, Clarithromycin, Roxithromycin, and of course this Azithromycin. These are the most important macrolides what we are commonly using nowadays for different infection and different disease. You know, mechanism of action, they just stop the bacterial protein synthesis, and by blocking the bacterial protein synthesis, they just stop the further division of the bacteria, the growth of the bacteria, and actually they are bacteriostatic antibiotic. So they inhibit the bacterial protein synthesis by binding with the 50S ribosomal subunits. Ribosomes have got two subunits, one is the 50 and the other one is the 30, and they are different in the eukaryotic cell and the prokaryotic cell. That is another topic that need detailed discussion. But these drugs, they just stop, they just block this 50S subunits, and they prevent the translocation of growing peptide chain, which leading to bacterial stasis. So they work as a bacteriostatic antibiotic, but at high doses they may be bactericidal as well. Now coming to the spectrum of activity, they cover a lot of gram-positive microorganisms like Streptococcus pneumoniae, like Streptococcus pyrogenes, and then Staphylococcus aureus. Of course, they also stop a number of gram-negative bacteria like H. influenzae, Moraxella, Neisseria, gonorrhea. They block all these microorganisms, and some atypical microorganisms. You know, for pneumonia we gave penicillin, and we also add some of the macrolides to cover the atypical microorganism. So they are very good drug against the atypical microorganism, especially this Mycoplasma, the Chlamydia and Legionella. These are the common the common atypical microorganism which causes multiple respiratory tract infection. And of course they can cover some of the protozoa like the Toxoplasma. Now coming to the pharmacokinetics, these are the drugs which are exclusively used orally. We use these drugs orally. Some of the drugs like Clarithromycin and other, they may be available in the parenteral preparation as well, but we use it orally and they get extensively absorbed. Remember, they have got food interaction. So ideally, all the macrolide, they should be either taken 1 hour before the meal or 2 or 3 hours after the meal. It should not be taken close to the meal. This is one of the clinical points that you must note with yourself. They are distributed throughout the body to the different body tissue. They are usually metabolized in the liver by cytochrome 3A4, and that's why we don't give these drugs in those patients who have got liver injury, in the cirrhotic patient or those patients which present with acute hepatitis. These drugs should ideally be avoided in those people, and they are eliminated. Some of the drugs, they are eliminated exclusively through the liver, while some of the drugs which has got the dual removal from the body, like Azithromycin, is removed through the kidney and through the bile, while the majority of the other like Erythromycin, Clarithromycin, they have got exclusive removal through the biliary tree. What are the clinical uses? They are used for a number of upper respiratory tract infections. So you start from the bronchitis, from the tonsillitis, from the sinusitis, from the pharyngitis, bronchitis, tracheitis, and for the lower respiratory tract infection like pneumonia, and then the atypical pneumonia. They can be used for the skin and soft tissue infection, especially this azithromycin and roxithromycin we use in impetigo, steroiditis, boils, folliculitis. We use in this condition. They can also be used for the sexually transmitted disease like chlamydia, gonorrhea, and they can be used for the H. pylori infection. You know, H. pylori infection of the GI tract. We give two antibiotics, clarithromycin and amoxicillin along with the PPI, and they can be used for the prophylaxis of endocarditis, especially in those cases where there is penicillin allergy to the patient. Then we have only this option. We use this drug. Then how bacteria develop resistance to macrolide? You know, the bacteria may develop the efflux pump, or they may change their target site tissue, or modification occur at the target sites. There may be some enzyme in the form of esterases, and these enzymes, they just start metabolizing the drugs, and the bacteria develop the resistance. And then there may be some cross resistance, like suppose if some bacteria develop a resistance to the one macrolide, they will have definitely develop the resistance to another macrolides. What are the adverse effects? The most common adverse effect what we have noticed at the upper the GI side of adverse effect in the form of dyspepsia, nausea, vomiting, and diarrhea. And they can cause QT prolongation. So one should ideally avoid these antibiotics with other antibiotics which can cause QT prolongation, like quinolones do the QT prolongation. So you can't, ideally one should avoid combining the quinolones along with the macrolides. And they can cause cholestasis because they are removed from the body through the liver, through the biliary tree. So they can cause cholestatic hepatitis, they can elevate the liver enzyme. And the most important thing is this cytochrome 3A4. By this mechanism, by blocking this enzyme, by inhibiting this enzyme, these drugs, they can increase the level of the warfarin, the statin, the carbamazepine, and thus the person can develop toxicity from those drugs. Now coming to the advantages and disadvantages of these drugs. So they are broad spectrum antibiotic. They have a very good activity against the gram-positive, gram-negative and atypical microorganism. They have a very good tissue penetration. They have fewer side effects. Like if we compare the adverse effect of the macrolides and the quinolones, quinolone has got more adverse effect as compared to the macrolides. And they are very safe in pregnancy, especially this azithromycin. Azithromycin is considered as a gold standard safest antibiotic in all trimester of pregnancy. You know, cefixime is also one of the safest antibiotic, which is the third generation cephalosporin, which I have already explained in my previous lecture. And what are the disadvantages? There is increasing resistance, the drug interaction, especially with erythromycin and clarithromycin. This is very important. They can develop a number of drug interaction, especially with the warfarin, with the statins, with the oral contraceptive pills, and with the these statins and carbamazepine, and the GI intolerance, especially if you take these drugs after meal, you can destroy the drug because meal has got interaction with these drugs. There will be decreased absorption of these drugs, and of course there will be dyspepsia and other GI symptoms. And what are the newer macrolides? You know, there is future development. We have new macrolides like ketolides, like next generation, like Azithromycin, and we have some other new drugs. They are also coming into the preparation. You know, these drugs, they have got anti-inflammatory activity as well, apart from these antibiotic activity. And now we are going to the summary. So to summarize this whole lecture, I will say a few words about the macrolides. These drugs, apart from being a very good antibiotic, they have got some anti-inflammatory activity as well. So suppose if you get a patient with asthma, with COPD, which is an inflammatory process, and at the same time if they get some chest infection, you can go for these drugs because they have got anti-inflammatory activity as well as they have got they have got a very good sort of activity against the microorganism. To summarize this lecture, macrolides are essential antibiotic with a broad spectrum of activity. They are useful in treating the respiratory, the skin, the GI, and sexually transmitted infection. Resistance is a growing issue, and we need new drugs developing, new macrolides developing. In future research aims to improve the efficacy and reduce the side effect. References, I have prepared this lecture from the books and from the online journals, and from the so many online materials, so you can go and you can use those references. With this, I came to the end of my today presentation. I hope you will have enjoyed this video. If you have really enjoyed this video, I will say please subscribe to my channel and share this video with your friends and colleagues so that it can reach to so many people and they can get benefit of it. Thank you very much. God bless you all. Allah Hafiz.